from fulfillment, purpose, connectedness, and love. Happiness affects us on a biological level. Happy people have lower levels of cortisol, a key stress hormone. They have more favorable heart rates and blood pressures. They have stronger immune systems. And they have lower levels of inflammatory markers, like C-reactive protein, which has been linked to coronary heart disease. It turns out, even when you control for smoking, for physical activity, and for other health behaviors, happy people live longer. There's something about happiness that seems to be protective. Now, I want to be clear. While happiness is an important factor in improving health, it's certainly not the only one. We know that good nutrition, exercise, and sleep are essential tools for preventing illness. And whether we're living with depression or with diabetes, treatment is essential too. Yet among all these factors for improving health, happiness stands out as a largely untapped and unrecognized resource that has the potential to transform health for individuals and for communities. Now, as an internal medicine doctor, I've had the great privilege to care for many patients over the years with a wide range of illnesses, from cancer to infections to heart disease to diabetes. But perhaps the most common condition I've seen is unhappiness. Unhappiness that stems from isolation, from lack of meaning, and from a loss of self-worth. I've seen this as Surgeon General too. As I travel around the country, I meet people who are stressed, worried, and anxious. And this includes many children as well. They find themselves constantly surrounded by news stories and narratives that only remind them time and time again of all the things they have to be worried about. All this unhappiness is important because unhappiness is a risk factor for illness. Now, you might ask yourself, does happiness really lead to better health? Isn't it the other way around? Doesn't happiness result from good health and favorable circumstances? We might sometimes think, I'll be happy if only I lose 15 more pounds, or if I get a better job, or if I make just a little more money. But the truth is that while circumstances can and do impact our short-term happiness, our long-term happiness is far more driven by how we process life events than by the events themselves. So if happiness is protective, the key question is, can we create it? The answer is yes. And the way we do that is surprisingly simple, and it largely costs nothing. The research tells us that gratitude exercises, meditation, exercise, and social connectedness are just a few of the tools that we can use to increase happiness. Take gratitude, for example. One study took participants and randomized them to 3 different groups. In one group, the gratitude group, participants were asked to write down 5 things they were grateful for. In the second group, the hassle group, the participants were asked to write down 5 things that hassled them. And in the third group, they were asked to write down 5 things that happened without a positive or a negative slant. Now, at the end of 10 weeks, it turns out the participants in the gratitude group experienced a greater level of optimism, and they had a more positive view of their life. But they also exercised for 1.5 hours more on average per week. They also slept better, and they had fewer physical symptoms like pain, nausea, and headaches. The simple practice of gratitude had the power to increase their happiness and to change their health behavior and their health outcomes. And perhaps one of the most powerful examples of cultivating happiness comes from Visitation Valley Middle School in San Francisco, California. Some years ago, Visitation was struggling. They were struggling with low test scores, with high suspension rates, and with so much community violence that they had to hire a full-time grief counselor at the school. They tried all kinds of things to help. They started after-school programs. sports programs, peer counseling programs, but all without much luck. And then one day, they decided to take a leap of faith. What if, they asked themselves, we used meditation as a tool to reduce stress and increase happiness for our students? And so they created 2 15-minute quiet time meditation sessions during each school day. They taught the teachers and the students how to meditate. They taught the administrators how to meditate as well. And within a year, something incredible happened. Suspension rates dropped by 45%. Teacher absenteeism dropped by 30%. Test scores and grade point averages rose markedly. The students reported they were less anxious and they were sleeping better. And the self-reported happiness scores of the students went from one of the lower scores in San Francisco to the highest score in the entire district. As one student put it, our school went from being a place of anger, sadness, and fear to a place where we could be happy. I had the great privilege of visiting Visitation Valley Middle School yesterday. I had the chance to sit down with students and talk to them about their experiences. I had the chance to meditate with 6th grade students sitting on their very short stools. I had the chance to hear about the impact meditation had made not only on their life in school, but also on their life at home. I heard about how their parents have found them to be calmer, more focused, and just more fun to be around. I heard from one young man who grew up being discriminated against and felt a great deal of anger because of that. He channeled that anger into bullying other kids. But he told me after he started meditating in school, he learned to calm himself. He gained a stronger sense of self-worth, and he stopped bullying other children. These are remarkable stories. And I can tell you firsthand that what Visitation Valley Middle School is doing is increasing happiness. And their model is being replicated at other schools now with comparable results. What is so striking about these tools for increasing happiness, meditation, gratitude, social connection, and exercise, is that they are simple and accessible. We have become accustomed to thinking that complex problems require complex solutions. But that's not always the case. Sometimes simple solutions can enable us to take on some of our most intractable problems. That's what happiness can do when it comes to health. If you think about it, all of us have the power to create happiness in our lives. But we also have the power to help create happiness in the lives of others. And if you need proof of this, I'd ask you to join me in a short exercise I learned from the legendary Mr. Rogers. Close your eyes for 10 seconds with me and think about the people who have brought kindness, understanding, and joy into your life over the years. I'll keep track of the time. The people you remembered have helped you be happy. I remembered my wife Alice, my mother, my father, my sister Rashmi. They have brought happiness, joy, and health into my life for so many years. Each of us has the power to touch other people's lives, sometimes with just a simple gesture or a kind word. Imagine if happiness and emotional well-being were prioritized in our schools as much as test scores and grades. Imagine if cultivating happiness was a priority in our workplaces. Imagine if our policymakers understood emotional well-being to be the fuel that enables us to be healthy, productive, and strong. So as we grapple with the challenges of how to create a healthier, stronger world. Let us remember that happiness is a powerful tool for health. Let us remember that we can create happiness in our lives and in the lives of people around us. Let us call ourselves and each other to action to ensure that emotional well-being is part of our policies, part of our institutions, and part of our way of life. If we do this, we will create a world that is full of joy, a world that is full of health, the world our children deserve. Thank you very much.
I'm so pleased to be here with all of you today on World Mental Health, and also honored to welcome to our school Surgeon General of the United States. Dr. Murthy is a strong spokesman for well-being and so many important causes, and we couldn't be more privileged to have him with us today. Here at our school, we live by a set of values. Underneath these values, such as respect, trust, and compassion, lies an understanding that the well-being of the community is inherent to our growth and inherent to our culture. My mother, as she built this school, prioritized well-being, and she envisioned DAIS as a happy place where learning is a joy and teaching a pleasure. It is my hope that we can all work together in prioritizing mental health because it matters to each and every one of us. Once again, it is my pleasure to be here today and to host Admiral Vivek Murthy.
Good morning, students, teachers, distinguished guests, heads, Mr. Mike Hankey, the US Consul General, and Dr. Paul Richards, the head of school at the American School of Bombay. It is my honor to welcome all of you to this very special assembly today. On the occasion of World Mental Health Day, it is my pleasure to introduce our esteemed guest today, Dr. Vivek Murthy, the 21st Surgeon General of the United States of America. The role of the Surgeon General in the United States is to be the chief medical officer of the country and to provide the best scientific information to all the people. The broad mission of his office is to protect, promote, and advance the health of the United States. Dr. Murthy's expertise in the field of public health is unparalleled, having led the response to the global health crises such as the COVID-19 crisis, the opioid crisis, and the Zika and Ebola viruses. During the COVID-19 crisis, he led healthcare efforts, co-chairing President Biden's COVID-19 Advisory Board. In addition to his exceptional medical expertise, Dr. Murthy is a tireless advocate for the overall well-being of individuals and society. He has elevated issues such as youth mental health, social isolation, and misinformation in the field of medicine to the forefront of public health discourse. His revolutionary manner of thinking in that healthcare should not just be defined as the absence of diseases and maladies, but the presence of well-being, social connections, and robust mental health is a contemporary and necessary way of looking at things. By recontextualizing Dr. Murthy is pushing the world towards not just a healthier, but also a happier state. His advocacy for the building of a society where the mental, physical, and social well-being of all individuals is prioritized is something that I'm sure we can all appreciate. It is a great privilege to have him here with us today. Please join me in warmly welcoming Dr. Vivek Murthy. I would hand it over to Sahil Gurbaxni, the leader of the Student Wellbeing Task Force at the American School of Bombay, and Avantika Kampani, the head girl of the Dhirubhai Ambani International School, for the fireside discussion on this topic today.
Well, thank you so much for that incredibly kind introduction. And I want to just tell all of you how excited I am to be here today, not just because it's World Mental Health Day, but because this is an important event to talk about a topic that affects all of our lives, and that is mental health and well-being. I particularly just want to thank, first off the bat, the Ambani School, the American School, our Consul General, and team, just for putting this event together, which was no small feat in terms of all the logistics, but it's given us the opportunity to be here today. And I'm very grateful that Sahil and Avantika have agreed to subject themselves to me on stage with this conversation, but I think it will be hopefully a good one. I want to say on a personal note, this is my first time coming to India as Surgeon General. I spent many times, and my visits to India in the years before. I first used to come here to visit family down south in Bangalore and other parts of Karnataka. And then later, I actually got my start in public health right here in India, working on initially HIV projects in Bangalore and Mumbai and New Delhi, and then later building community health worker programs down south in small villages in Karnataka. But I look at so many of the cultural and spiritual traditions I have in my life as being deeply rooted here. It's what my parents absorbed as they grew up here. It's what they infused my childhood with. And even just hearing the shlokas play in school when I was walking in today just reminded me of home. So it is a true honor and joy to be able to come to India and to spend some time here. On the topic of mental health, today is World Mental Health Day. And the reason this is so important is because we're realizing more and more just how important mental health is to our overall well-being. I'll be honest with you, when I was in medical training, I didn't learn a whole lot about mental health. It wasn't really a significant part of the curriculum. Maybe we had a few days worth of teaching on it over the span of 4 years. But what I came to realize very quickly is that many of the patients I was caring for, whether they were younger or older, were struggling with their own mental health. And if I was honest, when I looked at my own life, I actually had my own struggles as well. As a student, I did struggle with my mental health, but never talked to anyone about it because I felt ashamed. I thought maybe I had done something wrong. I didn't want to be embarrassed by admitting that I was going through a hard time. And so putting these together, when I became Surgeon General and had the chance to speak to people, especially young people all over the United States and then increasingly in other parts of the world, I realized that we were in the middle, in the United States in particular, of a youth mental health epidemic. And that if we didn't do something to address it, that we would be sacrificing the overall well-being of children. What we've realized more and more now is that mental health is the fuel that allows us to show up in our life for our families, in school, in the workplace, and in society. And if we're not making sure that that fuel tank is full, then it's almost like trying to fight with one hand behind your back. And so that's what we're here to talk about today is what does good mental health look like? What can we do to actually improve it? And how can we have conversations about this really important topic? So let me start off the conversation, Sahil, Avantika, by asking both of you, what is your picture of good mental health and well-being? What does it look like to both of you? Avantika, why don't we start with you?
Yeah, sure. So to me, being mentally well and happy is being safe and comfortable with the people that you surround yourself with in the environment that you are in, but also most importantly with yourself to a really large degree. I believe that like all learning, whether it's intellectual or social, even emotional learning, begins from a very, very young age. So being able to have conversations about how you're feeling with the people around you and the people that you love most is working towards bettering yourself and bettering your well-being.
I think to mirror what Avantika spoke about, at school, at the American school, I see a state of mental health and optimizing mental health to be a space where students and children feel a sense of comfort and are feeling comfortable learning and adapting to this environment. And I also think that students need to have confidence within themselves. I think a lot of what we lack is students being proud of themselves and students feeling that they're worthy and that they can make a contribution to the school, right? And so students building that confidence and students feeling a sense of belonging in our community is something that we with the task force are really trying to develop as well.
I like that. Those are beautiful descriptions of what well-being could look like. Now, I want to ask you about how we talk about this, because the vision you're describing of well-being, I think, is something that many people would want in this room and around the world. Why is it that you think we have a harder time talking about mental health than we do physical health? I suspect that if somebody in this room broke their ankle, that they probably wouldn't have too much embarrassment saying that, admitting that to classmates or to family members. Yet it feels different with mental health. Tell us a little bit about why you think we treat mental health differently.
I think certainly in a culture especially like India's, there's a certain stigma attached to speaking openly about well-being and mental health. I think students, particularly in India, find it difficult to open up and speak openly about it. And I think that comes with certain societal pressures. I think speaking openly about mental health often indicates a notion of weakness. And I think that notion has been established. So breaking down that notion and breaking down that barrier to actually have more open conversations will certainly allow students to open up about their mental state.
And I think those stigma is very true and it's very real. Something more fundamental is our ability to recognize how we're feeling, our emotions, process them, and that's a step before being able to even communicate them. So I feel like, especially in a country like ours, recognizing what mental health is, recognizing what your emotions are, what they entail, being able to understand them for yourself first before you put them out is also really important.
That's actually a really important point about language in particular, because when we don't have language, we can't describe what we're feeling. It's hard to communicate about it with others. But interestingly, traditionally in education, we haven't thought so much about language around mental health and about emotional learning as being a key part of what the skills and tools you need to build a healthy life. But if for anybody who manages a workplace or who has been out in the world, and worked, you know that those emotional skills actually really matter. Being able to read somebody else, being able to build healthy relationships, manage conflict, all of that is really vital to being able to function in society and feels like a vital part of the learning that we need to build in our lives. I'm also curious just to get your perspective on what you think is contributing to many of the mental health challenges that young people are facing today. Avantika, you want to start us off?
Yeah, sure. So I think a lot of Indian students especially, they're extremely ambitious. Like we really, really want to do well in everything that we do, whether it's our academics or sports or extracurriculars. And even if it's not familial or parental pressure, there's a lot of pressure that we put on ourselves in terms of our expectations for where we want to reach and our goals. And sometimes those are difficult to reach, and we get really, really disheartened when we don't reach those standards. And that definitely is a contributing factor to the way we feel and think about ourselves.
Yeah, I think to parallel what Avantika was talking about, I've seen these irrational and often just unattainable standards and demands that are placed on students. And often when students don't reach these demands or don't match expectations, they are subjected to, of course, feelings that they're not worthy enough or they're not good enough. And that spirals then, right? And then they go into the spiral of, okay, I'm not worthy enough, and then they have mental health challenges that stem from that. I think social media is another driving factor. Social media and the idealism that social media presents is also an hindrance for students like us. We see this idealistic, extravagant life on social media, and often it's unattainable. But we try to match our expectations and their expectations, and that just hurts us even more.
It creates a really big culture of comparison, I would say, looking at someone else's life, looking at someone else's achievements, and then looking at yours and not feeling enough, and that's a huge issue.
Well, I'm glad you raised this, and let's talk about social media for a moment since you brought it up. And I want to circle back to a word that you used twice, Sahil, which is worth, because I want to talk about what really actually does define our worth. But when you talk about social media, this has been an area that we've been concerned about in the United States as well, and we've been working with other countries on this issue. And the reason that we became concerned about it is because as I traveled our country, I found the number one question I was getting from parents was how to manage social media in their children's lives. Because what they saw is that it was taking over their lives in a few ways. One, in terms of just sheer number of hours. In the United States, the average number of hours an adolescent spends on social media each day is about 5 hours. That's the average. That means that there are many who are spending 6, 7 hours, and there are some who are spending less. But parents were also seeing the effect that that time was having, like on their kids, in terms of this erosion of self-esteem. As just what you said, Avantika, the culture of comparison that is sort of amplified dramatically online. That can be really detrimental to someone's sense of self. Now, we've been comparing ourselves to people for generations, right? That's not new. But what is new is the scale at which we're able to do it now on social media. Rather than comparing yourself to 10, 20 people in your class, now there are hundreds, sometimes thousands of images you may see a day. And I think that's one of the reasons why we're finding in the research that nearly half of adolescents say that social media makes them feel worse about their body image. A third say that they feel addicted to social media. We're finding that young people who are spending 3 or more hours a day on social media face doubling the risk of anxiety and depression symptoms. And the data like this goes on. It's not to say that there aren't some benefits, that people can get from social media, staying in touch with old friends, being able to discover new content, sharing, and expressing yourself, in creative ways. All of that is true. But we have to balance that against some of the risks. So as you both think about social media, can you talk a little bit about how you manage it in your own lives?
Sure. So I actually just recently joined social media. I joined it this January, and that was primarily because all my friends had it. I didn't want to be left out. I think we all experienced that. But something that I've found particularly important to me is that I don't take anything on social media for what it is. I think I always see content as something that's put on a screen, that's pre-rehearsed, and it's often just a skit, right? And it doesn't represent what happens in life. And I take it with a pinch of salt often, the content that I see.
Yeah, so I joined social media during COVID as a way to sort of stay connected to my friends during that period of time. Something that I do is try to maintain my in real life social interactions as much as I can, whether it's going for a walk with my best friend every evening or spending time with my family, because something that we've even studied in class at psychology is called parasocial relationships and interactions. And these are sort of pseudo relationships that form between social media users and media personae, or the Instagrams and influencers that you see on social media platforms. You form relationships with these pseudo-personalities that you don't actually know, and these kind of replace the real-life relationships that you have and are more meaningful and do matter more. So I try to emphasize these in real-life meetings, conversations, and hangouts that I can have with my friends and my family as much as I can.
One of the things I really like about what you both said is that you've been trying to, it seems, to draw boundaries around your use of social media. And that's really important. It also can be really hard, right? Because the platforms are designed to often maximize how much time we spend on them. And many of the features can keep pulling us in. Now, one thing I think that's just important to know about the brains, the developing brains of adolescents, is that they're not the same as the brains of adults. And so when adolescents' brains are developing, they're also more susceptible to social comparison, to social suggestion. Impulse control is less developed. And so if you take an 11, 12, 13, 14-year-old, and you give them a platform that has been designed by some of the best product engineers in the world to maximize how much time they're spending on them, that becomes a very difficult battle, for an adolescent to fight on their own, which is why working together and making these pacts together to draw certain boundaries can be helpful. I'll give you a couple of examples of how I've seen this done. I've seen some families say, you know what we're going to do is, in the night, we're all going to put our phones to charge in the kitchen. And then we're going to go to bed. And then we're going to wake up, and then we'll check our phones. Now, I know this sounds crazy, right? Because so many people are used to having their phone with them all the time, checking in the middle of the night when they get up to drink a glass of water. And while that seems like the normal thing to do now, what we're realizing is that it actually really impacts the quality and quantity of sleep that people get. And we underestimate how important that is for our physical and mental health. The other thing that I've seen people do is to say, you know what, meal times and time, dinner, lunch, breakfast, when I'm eating with somebody else, or even when I'm just taking a walk with somebody else, I'm going to put my devices away so we just focus on each other. Because if you're like me, you probably had many conversations where you were talking to somebody and then you realized that they were distracted because they were checking their phone, right? And we all do that. I've done that too. I'm not proud of it, but it happens to all of us because we're so used to always checking and refreshing our feed or our inbox. So drawing these boundaries is really important. The more we can do them together with other people, it can help. And that's actually what I had to finally do in my own life. Is I have two dear friends who I knew were also trying to figure out how to manage social media in their lives. And we had to come up with a pact between the three of us around the boundaries that we drew, where we were not going to use social media, put away our phones. And then we had to hold each other accountable to that. So we would check on each other periodically and say, how's it going? And then I'd sometimes admit, okay, I slipped here. They'd say, okay, well, let's follow up next week and see how you're doing. So that kind of external accountability can help. Okay, do you want to say something, Sahil?
Yeah, I think you raise a great point, but at the same time, I think our reliance on social media has become so substantial and so significant that often we feel that our lives are not moving if we're not on our phones, if we're not looking at the new update, if we're not looking at our friends' stories. And I think it's also important for us to realize that there's so much beyond what's happening on social media, and that we don't have to be so reliant on it.
I think that's something that we call FOMO also, like the fear of missing out. And a lot of us have that when we see our friends going to a party on social media and we're just stalking their Instagram profiles to see why we weren't there. And like he said, we kind of get caught up in everything that's on these platforms and stop looking at what's really around us. And I think that really contributes to the loneliness and isolation that we feel occasionally as well. So yeah.
Avantika, I want to pick up what you just said there around loneliness and isolation, because you're right that for many people, social media can paradoxically end up making them feel more isolated from others. It's also true that loneliness has become a broader challenge for people across the world, particularly for young people. One of the things that we have found is we have now a World Health Organization Commission on Social Connection that I'm a part of that brings together ministers of health from different countries, from Chile, from Sweden, from Morocco, Japan, etc. And what we have realized is that many countries around the world have really high rates of loneliness, but interestingly, these rates of loneliness are highest in many countries among young people, despite and sometimes because of how tethered they are to technology. In the US, for example, more than 50% of young people say that they are struggling with loneliness, more than 50%. And we know that matters because, and again, something else I did not learn in medical school, but learned later, was that loneliness and isolation are associated with increased risk of depression, anxiety, and suicide, but they're also associated with increased risk of heart disease, of dementia, of premature death. So our social connections actually are vitally important for our physical and our mental health. And the fact that many people are feeling lonely creates additional risk for us. So when you think about this issue of loneliness, is this something that you think people around you are experiencing? Is this something that you talk about with your peers?
Yeah, I think it is something that we discuss a little bit in our school, in our classes, and with our peer group. We've sort of talked about how loneliness doesn't really mean being alone in the literal sense, but it's more a feeling and a state of mind that you are in. And in order to escape that kind of state of mind, you do have to start building emotional connections with the people around you. So like you said, I think everything in the realm of mental health is really interconnected, whether it's communication, understanding, and being there as support systems for the people around you when they can't be for themselves.
I think for sure, while we're on social media, and we're chatting with our friends online or whatever it may be, I think we're still alone, we're still isolated, and that contributes to that feeling of loneliness. But I wanted to ask you something, if you don't mind, is how do we balance and maintain that relationship between our social lives and then our time alone on social media or something like that? How do we find that sweet spot or that balance?
Well, that's a good question, and I think it's the question millions of people around the world, I would say actually billions of people are probably grappling with. I think about an old video I saw that was a video of a short lecture by a professor who had a big glass jar, and he put sand in the jar, right? He had sand, he had big rocks, and he had small pebbles, right? And he said, how should I put these in? Which ones should go in first if I want them all to fit? And what he showed very clearly is that if you start with the sand and you fill the jar with sand, it's really hard to squeeze the rocks and the pebbles in. But if you put the big rocks in first, and then you put all the pebbles in around the big rocks, and then you pour the sand in and it fills in all the small holes, then you can actually get things to fit, right? The point he was making is that the big rocks are the big priorities in our life. The small pebbles are the smaller priorities, and the sand are the least of our priorities. So what we need to do is fill our lives with the big rocks first. So when you think about how you spend your time, this is a good example of that. The big rocks in our life, in terms of what we're talking about, mental health and well-being, one of the biggest rocks is social connection, right? The relationships we have with people really affect our mental health. And let me define what I mean by that, because you might say, well, so-and-so is a contact of mine on social media. Is that a relationship? Like, there are different types of relationships, but the kind I'm talking about that truly lead to improvements in our mental health and well-being are relationships where you feel you can be open and honest with someone. You can be yourself. You don't have to pretend to be someone else. It's a relationship where if you are in crisis, that person would show up for you. It's also a relationship where you would show up for that person as well, right? These are the kind of relationships where we can truly be ourselves that really help us. So when we want to design how we spend our time and design our lives, those are the big rocks. And that means spending time in person with those types of people is important, or talking to them on the phone so you can hear their voice is really important. And finding ways we gather in person with friends is also powerful. Now, can we do that all the time? No. And sometimes we may want to just go online and check and see, what somebody posted, or maybe share our own idea or something that happened today, and that's okay, to do. But if it crowds out the big rocks in our life, that in-person time, the quality conversations we have with other people, that's when we run into problems. And when you see how much time some people are spending on social media these days, I told you 5 hours on average in the United States among adolescents, just the sheer number of hours means that there's less time for other things, right? Like sleep, like in-person interaction, like quality conversation. So I would prioritize those first. And when there's time in between, you can fill some of that in, with engaging with others on social media. But it is these quality conversations, in-person interactions that are often the most powerful in ultimately sustaining our mental health and well-being. Lastly, let me just say this. It's not always about quantity of time. Like if I gave you the choice of speaking to somebody on the phone for 30 minutes, where you were both distracted and both checking your phones simultaneously while you were talking, versus 5 minutes of conversation where you were just focused on each other, the 5 minutes will feel better than the 30 minutes. And that's because our attention has the power to stretch time, right? For anyone who's out there trying to think, how do I add a 25th hour to the day so I can get more done? Well, this is the secret. It's your attention, right? Like the more you're able to focus on another human being and having a conversation with them, the deeper that connection will be. And the truth is, people know when you're not paying attention, right? And we know because it's happened to us, and we know when somebody else is distracted, right? And it doesn't feel great. And so when it's to the point where when you're able to really focus on another human being, it actually feels really special. The same way, like if you got a handwritten letter from somebody in the mail, you would think, wow, that's very unusual. Nobody does that anymore. It's becoming like that, unfortunately, with in-person focused interaction. But that's what we need more of in our life.
I actually had a question specific more to the Indian teenager. I feel like culture is such a big thing in our country, and it's a way that we really form community. So how do you think that participating in cultural activities or festivals affects the experience of loneliness or improves the experience of loneliness amongst teenagers in India?
Well, I think those cultural forces that bring us together, whether it's going to a temple or a mosque or a church for regular services, or whether it's celebrating Navaratri or other festivals together, these are really important moments for bringing us together. But there are also other occasions too. We think about, when people get married, the birth of a new baby, when someone passes away, when someone has a major life event like a graduation. These are all moments where we can gather, and those gatherings matter. Sometimes, like in this day and age, sometimes it can feel like, gosh, it's so hard to get up and go somewhere now or coordinate a get-together. I can just sit at home and just engage with people through my phone. Isn't that easier? It is easier in some ways, but we get a lot less out of it. So now 30 years ago, we didn't have the option of sitting at home and just connecting with everyone by your phone, right? So by default, everyone went to these engagements and get-togethers. Now we have to be proactive about it because our circumstances and environment has changed, but they remain just as powerful for us now as they were 30 years ago. And I actually try to remember that in my own life. When I get invited to a wedding, for example, or to a birthday party, sometimes I'm really tired. I'm like, oh, I don't want to go. It'd be easier to just like hang out at home and do nothing. But I'll try to just nudge myself a little bit to say, you know what, let me just push myself. And then I'll ask myself afterward, did I regret going or was I glad that I went? And it's almost always the case that I was glad that I went. So, yeah. I want to ask both of you, we'll chat for a few more minutes and then we're going to open it up to some questions and answers from the audience. But I want you, Sahil, to tell us a little bit about the task force that you're working on at the American School that's focused on student mental health and well-being. Tell us a little bit about why did the school form that task force and what kind of initiatives are you working on to support student mental health?
Sure. So we run the American School of Bombay Student Wellbeing Task Force, and it's a group of 22 students across all grades in high school. So and our primary focus is we've divided well-being into 4 primary components. So we've got physical well-being, we've got emotional, we've got relational, and we've got environmental. And all of us students work towards a state of thriving and creating a sense of thriving within our community. So some of the initiatives we have taken or looking to take, so we're looking to start a peer counseling group. And often we see that students feel more comfortable opening up to their peers and because it creates a sense of trust, right? And so that's something we're looking to establish at our high school. And another thing we're working on is getting in more extracurricular activities and physical activity within the school day. So I've actually found that aerobic exercise contributes directly to stress and the stress levels of students and their working memory and cognitive function as well. So with that research, we found that physical exercise is a must for students. And so that we're working on initiatives where we can push students to actually go out, have fun, and compete, play, whatever that may be. So those are some of the initiatives that we're kind of trying to establish.
I think it's quite similar in our school too. I think one of the strongest things about DICE is the community that we have with our teachers, but also more importantly across grades with our juniors and our seniors. And a lot of that is in like the inter-house competitions that we had. Even this morning we had inter-house Kho where we had students from across grades coming and playing together. And I think that really creates a sense of community that we all value a lot as students. Even through CAS projects, like I remember being in the 6th grade and I had a CAS project with the 12th and 11th graders called the Mirror Project, where they just asked us about our apprehensions and our aspirations, and that really helped me personally and a lot of my friends in my grade, even when we were that little. So I think that has been something that's really important and really valuable of our school. And another thing is how much we truly maintain our Indian identity, like something that we've started recently for physical exercise and also focus and attention is yoga. Every grade does yoga, I think once in 2 weeks. And that is also a way that we can spend time with our friends, but also get that amount of physical exercise in our day.
These are great examples and wonderful programs. And because you're exactly right that physical activity, yoga, meditation, sleep, social connection from peers and others, these are all vital inputs into our mental health. If we want to fill that mental health tank, if you will, these are all very effective at doing that. And what you're both demonstrating is that young people can actually lead the way in doing that. Now, you don't have to have a medical degree or a nursing degree in order to be able to support the mental health and well-being of people around you, just as you both described. So I think this is really powerful. And ideally, these are the kind of things that we would do in schools everywhere, right? Where we would be able to truly, through schools, build a foundation for a healthy, fulfilled life later, right? Which we know means supporting mental health and well-being. So it's very powerful to hear that both of you are working on this. In addition to what you mentioned, and if you think more broadly beyond school, think about society more broadly, what kind of things do you think society could be doing that would ultimately support the mental health of young people?
I think the primary most important thing is conversation. Like we mentioned earlier in our conversation that there's a lot of stigma that surrounds talking about mental health and these issues. So being able to have conversations with your friends, with your family, with even a stranger about how you're feeling is extremely important. That sort of comfort and safety in your own emotions. And being able to share them is probably the most fundamental and most basic step, and we can only build forward from there.
I agree with what Avantika said. I actually wanted your perspective on this. How do we work towards destigmatizing mental health and conversations about mental health in our society, even in our schools or our communities?
Well, it's a good question, and I think you're both focusing on this issue of how do we talk about this more openly, which I think is the first step toward addressing any problem. Look, I think even having conversations like this are a first step. The fact that both of you have been so thoughtful and so authentic and honest about discussing a topic like mental health, I'm sure will speak to so many people, who are listening today and who think, maybe this is an issue that's okay to talk about. So I think that's one step, is having these kind of events. But I think even having bodies, like at our school, like you mentioned, the task force, these types of bodies send a signal to people like, oh, this is something that matters. We've created a task force on this because it matters, right? So that's a second signal. Through structural change, we can send signals about what matters. But the third thing we can do is we can start ourselves sharing our own stories about mental health. And every time you share your story, you give permission to other people to do the same. And that's important for us to remember. It's like we're not just doing it for ourselves, but we help other people too. And culture changes fundamentally when people's beliefs and their understanding about an issue changes, and when that drives behavior change. And that's what more conversations can ultimately do. Now, you don't have to just be like, a major entertainment figure or a business leader or somebody who's famous to talk about mental health and have an impact. When you talk about mental health as a student, for example, your classmates are listening, right? And that impacts their lives. So we all have the power to, in our own circles, destigmatize mental health by talking more openly about it. Now, one caveat I want to share here is that because everyone is at a different stage of their understanding about mental health, and some people may see mental health as less important or something to be ashamed of, there might be times where you go to somebody and share about your mental health journey, and they don't know what to do, or they may react in a negative way, right? And so we just have to know that going in, that it's not because necessarily they're bad people per se, but they may not understand how important this issue is. And look, that applies to our parents as well, right? Like our parents love us, they love us dearly. But mental health has evolved over generations in terms of how people think about it and understand it. So the generation above you may be less comfortable talking about mental health, but still that kind of sharing is important. One of the things that I've realized, as somebody who grew up in the United States with parents from India who had different cultural understandings, than what they saw around them in the U.S. I realized over time that my parents were also evolving in their understanding of different topics, including mental health. And us, being able to be kind and generous toward our parents as well as we have these conversations is important, because all of us are on a journey to understand more deeply what mental health is all about. So, as we'll do one more question, then we'll wrap and transition to Q&A. But I'd love to just understand, if both of you were talking to a peer, to a fellow student, maybe it's a student you know, maybe it's somebody who's out there who's watching, who's at a different school, in a different city, and is just tuning into this conversation on mental health, what advice would you give to a young person who's maybe struggling with their mental health about what they should do?
I think I would say that it's okay, and allow yourself to be vulnerable, allow yourself to seek help. And I think you should never be ashamed of seeking help. And it is such a pertinent issue in society today. And just be comfortable, and you all have worth, you all have a sense of belonging in our community. So just feel that and ask for help. It's okay to make yourself feel vulnerable.
And like he said, to not feel alone is really important. We're all going through something in some capacity. So everyone's capable of understanding and being there for you when you're going through something. So it's very much okay to ask for help when you need it.
That's really good advice. And I think those key points, if people understand that mental health is just as important as physical health, if they understand that it's okay to talk about mental health, and if they understand it's okay to ask for help, those three things could be lifelines. And I want to be clear that if someone is struggling with their mental health, and if it's affecting their life profoundly, if they're having certainly thoughts about harming themselves, if they're not able to function because of how profound their mental health challenges are, those are times where we really do need to ask for help. And we're seeking out help from a mental health professional, is the right thing to do. But many of us can be the supports also that our friends need on that journey. And Avantika, what you said at the end was exactly right, that we think sometimes we're alone in this journey, that we're the only ones struggling, because we look all around us and it seems like everyone is doing great. They're posting these wonderful images online about parties they're going to and wonderful achievements and all kinds of milestones, and everyone seems to be happy, and maybe I'm the only one who's struggling. But despite those masks that all of us wear as we walk around, the reality is very different underneath. And we know, and I know directly from the stories and data and engagements we've had, that there are a lot of people who are having a tough time. And the more we're able to talk about that, the more we can support one another. Finally, there's a word that you used twice in the beginning, worth, which I just want to circle back on as we close here, which is that both of you have said that if people don't feel like they're worthy, that they're valuable, have anything to add to the world, it's hard to feel good about your life, right? We all need to have a fundamental sense of self-worth. But the real question is, where's our self-worth coming from, right? What's determining whether we're worthy or not? And I worry sometimes that we live in a world that's too often telling us that our worth is tied to how much we can achieve, how much fame we can acquire, how much money we can make, and how much power we can amass. Now, there's nothing wrong with any of those things, right? Achievement is great. Acquiring all of these things is wonderful. The problem is when we come to define our worth based on that. I look at my own two children. My kids are 6 and 8 years old, so they're a lot younger than you, but I hope that when they get to be your age, they'll be as wise and as thoughtful and as composed as both of you. But when I look at them, what I know is that they don't have any of those elements I just talked about. They haven't achieved sort of traditional things, on their resume. They haven't acquired any money, fame, or power. But I know that they have fundamental worth, right? And why is that? Because we're all born with this ability to care for one another, to contribute to the lives of people around us. We're all born with the ability to give and receive love, right? This is our inherent gift that we come into the world with. That's the ultimate source of our worth. And if we can help each other remember that, then we can do a lot toward helping support people's mental health and well-being. And that's what you can do as friends. Anyone who's watching here who has somebody in their life who's struggling, the most powerful role sometimes of friends is to be a mirror, is to help you see what's really inside of you, understand what makes you worthy, that you may not be able to see yourself because the clouds of strain and struggle, have blocked your ability to see what's truly worthy about you. So as we close our conversation, I want everyone just to remember that we all have the power to be healers, to help others with their mental health and well-being. And sometimes you never know when just reaching out to somebody to check on them, giving a supportive word to someone, or just being there with them when they're having a hard time can make all the difference in the world. Avantika, we're going to do some Q&A, so let me turn it over to you to moderate the questions.
Thank you so much. I think we both really enjoyed our conversation today. We'd like to turn it over to some questions from the audience, if mics could be passed to those who have questions.
Hi, thank you so much. I think this was super insightful for all of us. I wanted to know, so from whatever I've seen at least about social media and more the content consumption angle of social media, it seems to constantly, or the algorithms at least for Instagram and YouTube and the others, they seem to constantly keep throwing up the same thing again and again if you open like one post about that. So for example, the other day I opened a post about a salad and now my entire page is just filled with salad recipes. And I think over time, at least, this compounds into creating maybe a sense of paranoia. Do you think social media is having that effect, like this genuine paranoia is being created because of the echo chamber nature of the algorithm? And do you see any particular policy changes we can make to help maybe reduce the paranoia that's created by these echo chambers? Can we regulate the algorithm, or is there anything else that, I don't know if this is a problem that you've thought of?
Well, it's a very thoughtful question. I appreciate it. I do think that there are some real challenges with the algorithms on social media right now. I think while they can be useful in some ways in terms of bringing you content that might be relevant to you or help you find solutions that you might need for a particular problem in your life, too often what we're seeing is that the algorithms are pushing content to people that ultimately just maximizes, again, how much time they're spending on the platforms. But also in some cases, that content can be harmful. And we have seen that actually with young people in particular. I've actually spent time with young people and their parents and heard just very painful stories about videos encouraging self-harm and other things of that sort that were pushed by the algorithm to young people who were just struggling and were at a vulnerable point in their lives. So I do think what we have to do is, like we do in many other industries, like there should be accountability for the impacts, of these algorithms. And that's something in the United States, I will say, that we are actively working on right now. We have in our government, in our federal government, the equivalent of our central government, we have multiple legislative measures or bills that are in the works right now in an attempt to create policies that will ultimately make social media safer for young people. We want people to get the benefits of technology, but in this case, the harms have become significant enough for young people, including harms related to the algorithm, that this is a place where we need safety standards in the United States in place that can ultimately protect kids from harmful content, from addictive features, and other sources of harm. I know other countries are also working in these areas, and I think that the more we can work together as countries to recognize this as an important health threat to young people in particular, and the more we can work to share knowledge and information with one another about not just policy measures, but about steps we can take in our schools, in our families, I think that that kind of collaboration would benefit all of us.
Yeah, so I wanted to... Yeah, so I wanted to ask, with misinformation becoming such a serious challenge, especially in the context of health, what can we do to ensure that we are like consuming and sharing accurate health information?
This is it's such an important question because this has become one of the real challenges in the 21st century, and many of us saw the spread of misinformation during COVID, right, and how rampant that was, and many people, to no fault of their own, are caught in the crosshairs here and end up, getting misinformation about what treatment they should take or about whether they should be worried or not about a certain condition. So this is real and it's actually growing. And I worry in particular as we build more artificial intelligence tools that while there will be a lot of good that will come from that, particularly in healthcare, we have to be very thoughtful about how we manage and create safety guardrails around misinformation because you imagine if artificial intelligence technology can create something that looks like a scientific paper, that looks like it was published in a peer-reviewed journal, but that contains results that are actually directly contrary to facts and leads people away from helpful solutions, that could do real damage. And we already started to see some of that during COVID-19. How you do this is not easy, right? From a policy perspective, creating this safety guardrails and the accountability for companies is one step that our country and others are working on. But there also have to be changes that we make as users, right? We have to recognize that while there is a lot of misinformation out there, we have to understand what's the source of this information. Is it coming from a credible source, from, for example, a trusted medical or public health authority? We also have to be really cautious about sharing information. A lot of times we get some information, we see a health concern and we think, oh gosh, everyone should know about that. Let me post that online without necessarily checking to see if it's accurate or not or what the source is. I know this in part because my parents get WhatsApp messages and videos from their friends all the time that's like loaded with misinformation. And sometimes they'll ask me, is this true? And I'll say, no, that's absolutely not true. Don't listen to that and don't share it with other people. So what I often say is, if you're not sure, don't share, right? That's sort of the threshold we should have, as opposed to before when we thought, why not share unless it's clear that something is egregious or terrible or wrong? So we have to reset and flip our standard that way. And then finally, I think, and I say this as a call to action to our medical and public health profession, I think we also have to do more in medicine and public health to build even stronger relationships with the people we're serving in communities. Because one thing we know about misinformation is that while people may mistrust information that comes from sometimes large organizations that they don't know, etc., they still have trust. They still will trust information that comes from people they know, right? And so if doctors and nurses and local departments of health and community health workers can all build stronger relationships in communities and become those sources of information, that is a much more powerful path that we will need in the future because it's already happening now that when you see a patient in the clinic, a lot of times they'll say, well, I saw information online about this pill that I should take. I saw something about this disease I should be worried about. What's going on here? And for every one person who comes to clinic and asks that question, there are probably 100 who don't come to clinic but have the same misinformation coming at them. And so the more we have strong relationships as a public health and medical profession in our communities, the more we can become those conduits for trusted information. So this is not going to be easy to do. It's going to require a shift in personal practices, a shift in how we create guardrails around technology, and a shift in how we approach our roles in medicine and public health in communities.
think we have time for one final question.
So we all know that academic pressures can be a major cause for anxiety and stress. So firstly, what can schools and universities do to create an environment in which we promote mental well-being without compromising academic excellence? As well as what are strategies that students can use in order to maintain a healthy balance with academic goals and mental well-being as well?
Well, that's a really timely question, because I know that these pressures have been growing, not just in India, but in the United States, we're seeing that too. The term that many young people use in our country is hustle culture, which many of you use as well. But this notion that we're having to do more, move faster, chase in a world that feels more and more and more competitive. And how do we do that while taking care of ourselves? Now, the answer is not to say that we shouldn't strive and try to achieve or work hard. We should absolutely do those things. We should have big goals and we should work hard to achieve them. And we should celebrate when we do, and we should celebrate others who do as well. But if we do that at the expense of our mental health and well-being, then that is an unsustainable journey. And too many people are on that train. So the question sort of becomes, number one, how do we anchor ourselves as we strive to do more? If you think of striving as reaching your arms up towards the sky, how do you make sure your feet are firmly planted on the ground? And the forces that really anchor and ground us are what we have to think about, and we've talked about them today. We know that anchoring in our relationships and connections with each other helps. We know that anchoring and in protecting sleep actually helps our mental health and getting enough sleep. We also know that when it comes to our digital environment, that protecting ourselves from the self-comparison and negativity around us by creating boundaries around our use of technology, that can help as well. So we need that grounding. But the second thing we need is actually where we ended this conversation, which is to fundamentally have conversations in families, in schools, and in society more broadly about what defines our worth. If we are going to be a society that defines people's worth solely by what's on their resume, that's not a formula for the success and fulfillment of society, right? The triad of success we've talked about might be fame, fortune, and power. But what matters in life is really the triad of fulfillment. And that is driven by our relationships, by our sense of purpose, and by the service that we render. Those three elements, relationships, purpose, and service, these are what sustain us. This is what should inform our own sense of worth. And that's not easy to do on our own, which is why we have to have conversations and talk about this in our schools, in our families, in our communities. To me, this is as fundamental and as important to securing our future as learning to read or write or do arithmetic. Because if we go into the world without a firm grounding, a key understanding of where our worth comes from, without the relationships and communities to sustain us in the future, then I worry that we will only see these mental health strains and struggles grow as the world moves faster and faster, as more information keeps coming at us. There's a hurricane that's heading toward my home state of Florida right now as we speak. And I've been thinking about this a lot because I grew up actually in experiencing hurricanes, and a terrible one, Category 5 hurricane, when I was in high school. And I think of that hurricane analogy a lot because the world is like a hurricane that's moving faster and faster and faster. It was a tropical storm when I was growing up. It's a Category 3 hurricane now. That's what the world feels like. And so being able to anchor yourself despite that storm has become even more important. And so that's what I would encourage all of us to think about, is how do we build that anchor, and how do we talk about what contributes to our self-worth? Fundamentally, we all need a toolbox that we can reach into when we have those moments where we struggle with our mental health and well-being. I'll tell you just briefly as we end what's in my toolbox. First is friends and family. When I'm struggling, I sometimes have to push myself to reach out and tell somebody, but I'll do that now because I've realized it helps me. The second thing that's in my toolbox is my meditation practice. It helps me quieten the noise when the world around me is just buzzing. And then the third thing for me are sources of inspiration. So I have a whole series of passages from books and poems and other things, excerpts from scripture that over the years I've collected, that when I read them, they remind me of what really matters in life, right? And some of them are actually old movie clips as well. Sometimes speeches in movies, other scenes from movies, just things that speak to me and inspire me and lift me up. Whatever it is for you, whether it's poetry, whether it's music, whether it's some inspiring clip that you found in the past, whether it's a conversation with a friend or some quiet time in nature or in meditation, we all need to have things in our toolbox that we can reach to when that rainy day comes, when the winds are surrounding us and are buffeting us too hard. So I'm glad that we had this time together today. I know that our time has come to a close, but I just want to first and foremost thank both of you, Sahil and Avantika, for just being such wonderful conversation partners, just for being so inspiring in terms of the insights and the wisdom that you shared. If I had known a quarter of what you know about mental health when I was a student, I actually think I would have struggled a lot less with my own mental health and well-being. And so you are the kind of people who give me hope that the future is stronger, even though we may be dealing with a lot of mental health challenges. The fact that young people are actually leading the charge in many ways in overcoming stigma, thinking differently about mental health, that bodes well. And I also just want, as we close, want to thank the Ambani School, the American School, our Consul General here, as well as Ms. Isha Ambani, for their generosity and support in having this kind of gathering. I don't take it for granted that it's easy to have these kind of discussions, public discussions on mental health. Sometimes they can be hard, but they're really important, and I'm so glad we did this together today. Thank you all.
Thank you. Thank you, Dr. Murthy. I think we are all incredibly lucky to have you here and to listen to you, your wisdom, the words of advice on World Mental Health Day. It can't be bigger than that. Can you please all give a big hand to Dr. Murthy for taking the time to come all across here. And my gratitude to both of you, Sahil and Avantika, for taking out time. I know we just probably contacted you on Monday to turn this around in like 48 hours. So you all both came out in flying colors. Thank you for asking such pertinent questions to Dr. Murthy. May I request our student council members to come and give a small token of appreciation to Dr. Murthy here on behalf of all of us. And may I also now request our US Consul General here, Mike Hankey, Dr. Paul Richards, the head of American School of Bombay, Ms. Isha Ambani, our vice chairperson, to please come and join us on stage for a group photograph. I would request the rest of you to be seated as we take this photograph, and then Dr. Murthy and us, we leave from the stage, and then you would disperse as per your timings. Yeah. So much.